All right, go ahead.
Okay. For group 5, we also did muscular dystrophy. So a little overview. Muscular dystrophy is a group of diseases which can cause progressive weakness and loss of muscle mass. Within muscular dystrophy, abnormal genes interfere with the production of proteins needed to build healthy muscle. There are many kinds of muscular dystrophy, and the most common variety of this disease begins in childhood and mostly for males, while other types of muscular dystrophy surface during adulthood. There's no cure for muscular dystrophy, and medications and therapy help manage symptoms and slow the course of the disease. Some symptoms and assessments. The main sign of muscular dystrophy is progressive muscle weakness. And depending on the type of muscle dystrophy, specific signs and symptoms begin at different ages as well as different muscle groups. If you do notice signs of muscle weakness, which include increased clumsiness and falling, it is advised to seek medical advice. Types of muscular dystrophy, the Duchenne type muscular dystrophy, Becker, myotonic, fascio, I'm not going to try that, congenital, and limb-girdle. Some causes, since certain genes are responsible for making proteins which protect muscle fibers, we can see the defects of these genes cause muscular dystrophy. And every form of muscle dystrophy is caused by genetic mutation particular to that type of disease, and most mutations are inherited. Diagnosis, doctors are most likely to start with a recording of medical history and a physical examination. After that, your doctor may recommend enzyme tests, genetic testing, muscle biopsy, heart monitoring tests, lung monitoring tests, and electromyography. Treatment, there's no cure for muscle dystrophy, but treatment for some forms of the disease can help extend the time a person with the disease can remain mobile and help with lung or heart strength. There's new trials and therapies ongoing, and treatment options include medications, physical and occupational therapy, and surgical and other procedures. Some medications that doctors may recommend are like cortisone shots and steroids. There's new drugs including Cortisone and heart medications. Therapy, several types of therapy may improve the quality and length of someone's life. Those include range of motion and stretching exercises, braces, mobility aids, and breathing assistance. Prognosis and follow-up. The diagnosis of muscular dystrophy can be challenging. In order to properly cope, it is advised that one finds a family member or close friend to talk to during this time. If a child has been diagnosed with muscular dystrophy, discuss with your doctor the appropriate approach to discuss this progressive condition. A patient of this disease may be referred to a doctor who specializes in diagnosis and treatment of muscular dystrophy. So what you can do is just expect different doctor visits and ask questions on how to approach those, especially with your family and with your doctor, just to expect mandatory and consistent visits as well.